developed this initiation for sometime between October 1st and December 31st of 2017. We'll be hiring and training paramedic staff. I've been on record many times about this when I've said that I think some of the best people who will be able to provide great care to the residents of Wilson County are some of the folks who are already doing it. You know, there's no question that many folks across the EMS services across the county are well qualified, and I'm very hopeful that many of them will choose to seek these positions. They'll be paid positions, there'll be benefits, full-time jobs, and we think that that is one way to bring some real stability to the service. Most importantly, though, once we have the hiring process underway during the early summertime, we'll be developing some training and other protocols there, competency programs. Very similar to what we do for nursing. Sue, you just finished your annual nursing competency. 2 days worth of nursing competency, 3 days. How many people did you have go through it?
72.
And how many different topics did you cover?
About 8.
Okay, so really trying to get to a number of items there. Okay? The last piece of our plan is pretty simple also. The hospital doesn't have any ambulance space. You know, we don't have an ambulance garage. We're not in the ambulance garage business. There are 4 entities across the county that have ambulance garages. It would seem very natural that we could work out some type of arrangement where we look at ambulances themselves, we look at the existing equipment, we look at the existing space, and we try to figure out just how that all comes together. That's a big portion of our plan. Finally, the one piece that I continue to be on record of, and I think am often misquoted, is the piece that isn't clear yet is what happens to the ESDs after this develops out. What is the strategy? Well, we know that ESD number 2 is fire and ambulance, so it certainly needs to continue to be able to perform its service. And ESD 3 certainly also has some opportunity to work with us to figure out what happens to your service over time. So to me, that's one piece of the plan that still needs to be worked out, and we still may be a little bit early in that regard. So, going through a couple of other topics, hitting a few other specific items, here are some of the common questions that I've received. Number one, why is this being discussed right now? You know, what has happened that causes this to be a topic right now? And I think that's probably one of the biggest misnomers about this project. This isn't because of a single stimulus. This isn't because one thing has happened and we say, oh, it's all bad and it all needs to be reworked. In 1000% sincerity, this is a proactive attempt to deal with an issue that will have to be dealt with, whether it's today, 3 years from now, or 5 years from now, 10 years from now. The pressures on services like this will continue to grow. Our county will continue to grow. The number of licensed personnel will need to be maintained, and our effort is not a reaction to any negative thing that's taken place. It's rather some proactive work to help us make sure that every Wilson County resident has access to exceptional EMS service. It certainly doesn't hurt that as Judge Jackson saw this project, saw this need, saw the struggles that each of the 4 services were going through. That's been pretty easily publicized over the years. Maybe not today, maybe not last week, but the struggles that each of the services has had. As he approached us with this, it seemed like the right time to be having these conversations. Second question that I get, and it'll be real easy to answer this one. It's, will patients have a choice where runs only go to Conley? I've answered this question directly several times, been misquoted many times, but the answer is clear. definitive care guidelines drive where patients go. You guys know that that requires you to take patients to the next nearest facility that has the most appropriate care for the patient's condition. There is no question that definitive care guidelines will drive where patients go to receive care. That is 1,000% clear in my mind. The second question is, will patients have a choice? Many folks have said, well, you know, what are we going to do if patients don't want to go to Conley? Well, patients have a choice. Failure to honor patients' choice is not legal. You all as EMT providers, by failing to honor the patient's choice, will be putting yourselves in a terrible situation. So patients will always have a choice. The statement that I would like to make for the record for the 5th time is that definitive care guidelines will drive where patients go, and patients will always have a choice. There's no question in my mind about that. Who will be in charge? Who will be responsible? You know, this is back to the discussion we've already had. We are hiring a Wilson County Executive Director of EMS. That will be the leader of the service. That person will report directly to me as the Chief Executive Officer of the hospital, as well as to the Medical Director that is assigned to the service. That position is going to be an executive level position, the same as Sue Tackett is Chief Nursing Officer, the same as Woody White is Chief Financial Officer. This is a member of our executive team. Of course, both the Executive Director and I will be responsible to the board for updates about the operations and strategic activity of the EMS service, and we'll be making sure that that takes place. So the Medical Director will be the responsible party for clinical work, and then the Executive Director, reporting to me, will be responsible for the operations of the service. What will happen to the Emergency Services District? Again, that is to be determined, and I think each really, it's pretty clear what happens to ESD 2 as they have both a fire and ambulance service, and then certainly I'm eager to have the conversations with ESD 3 about how you all maintain your work in the future. What about existing equipment and capital? We've already covered that. I do believe that there will be opportunities for the hospital to have conversations with each of the organizations about their ambulances, about their garages, and try to sort out exactly how that can be best handled in the context of not just an individual plan by service, but in a plan across the county. You know, one thing, this may have changed since I last had this data, but I think one thing that the county faces is that, I believe the last data I had, there's 10 ambulances that are serving the county. A number of them are well over 5 years old. Again, years old versus mileage, we can talk about which is the best indicator. But the reality is that over time, those rigs will have to be replaced, and I think that a countywide comprehensive capital equipment replacement plan will be more effective than each individual service, you know, fighting through that on their own, having some support to that issue. Final item that I want to be on record of is what level of service will the Conley Memorial Countywide EMS service provide. We will provide 24/7, 365 mobile intensive care unit service across the county. I'm on record of that in a few other places. That is our hiring plan, that is our staffing plan, and that is where we will be heading in terms of providing that level of care. So I know when ESD 3 asked me questions about will we be able to maintain the level of care that is being provided now, the answer is absolutely yes. Today's meeting is just another portion of the public process that has gone on with this. We know that back in February we had our first EMS Summit type meeting. You'll probably remember August 9th was another meeting date that was had. That meeting was led with a letter to the individual ESD groups, to the mayors of each community, to the city councils of each community, to the commissioners court, and to each of the leaders of the ESDs, inviting everyone to come. It was actually published in the newspaper that this was happening, with the idea that folks should contact their elected representatives if they wanted to get more information about that. We had the EMS Summit. We had follow-up at the August 18th meeting. But then during the months of August and September, we had very, very open posting of all the activities in that regard. This is just a copy of the public hearing notice, the tax increase, appeared in the newspaper in the 7th, the 15th, and 19th. Frankly, no one attended any of those meetings. It was disappointing to our board. We felt that this was a hot topic, and we wanted to make sure that we were exploring all of the community's feedback. But you know, even with the public postings, we didn't have the participation that we wanted. We've certainly had participation since. It was great to see a good turnout of interested people at the October 20th board meeting, where I know, Ginger, you were there. I thought we probably had a pretty good conversation of all these topics at that time. Okay, good. This is nothing that I haven't already said. Mr. Smith completed his interviews, has done that work. This is an out-of-date slide. We now have 8 applicants. Screening has begun. We're downloading and have already downloaded the license application. But another thing has developed out, and I know that here at ESD3 you guys do a really good job with this, as do some of the other services. We're seeing a real problem with interfacility transports, not only from the hospital but from nursing homes, etc., to the hospital and to other locations. With the closing of some of the private ambulance services throughout the area, this transport issue has become heightened. We're hearing of some significant wait times in the nursing homes, significant wait times in our own emergency room, and this is a new topic that's kind of further up the ante on this whole discussion about how do we bring all of the ambulance services together towards a common goal. You know, I'm not so sure that this is valuable at this point. But one of the questions that was posed to me is, explain to me Endeavor Healthcare, explain to me Wilson County Memorial Hospital District and Conley. So I'm going to do that here for just a few minutes. And Judge, I think this does go a little bit back to your thoughts about the history of the hospital. Over on the left, you can't see this, I recognize that, but over on the left you can see that the hospital has had a long history of operating losses, of losses from operations. And there was a period in time, 2009, 2010, where those losses became really unsustainable. They became very, very troubling. $1 million in 2009, $500,000 in 2010, some pretty serious operating concerns. At that time, the board of directors entered into a management agreement with a company called Endeavor Healthcare out of New Braunfels, Texas. Carl Hiddle is the president and CEO of Endeavor Healthcare. Endeavor has the responsibility of managing the hospital's operations successfully, and working directly with the board, at the board's direction, in order to ensure not only the current operational success of the hospital, but also that long-term strategies are achieved. And without going into a lot of great success in detail, the graph right in the middle illustrates that there was a period of time, 2009 to 2011, where the red operating expenses of the hospital were well north of the blue operating revenues of the hospital. Endeavor came on board, began to focus on operational expenses, began to focus on growth, and got those two lines to cross in about August of 2012, to where operationally the revenues from the hospital were greater than the expenses associated with it. That's a big deal, guys. That is a big, big deal. Here's why it's important to Wilson County taxpayers, though. When we got those two lines to cross, we were able to use the about $3 million of tax support that we received in order to fund new programs, buy capital equipment, develop clinics, recruit physicians. As you saw in the first picture, all of those things were designed to increase access to care across Wilson County. And you can see we've been able to maintain an operational success during that period of time. Likewise, you can't quite see this. Again, this slide is really intended for other purposes, but in the upper right, the hospital was generating at one point in time about $14 million a quarter, about $14 million in gross revenues a quarter. You can see that graph is 2011, 12, 13, 14, 15, and 16. We just finished the fourth quarter of 2016 and generated $27 million in gross revenues during that time. So the hospital has grown, 75% over a period of 4 years, which is quite remarkable for an organization our size. Again, the growth has all been in additional access to care. By bringing docs on board, that allows us to provide more services to the community. But the last point that I certainly want to make sure doesn't go unnoticed is that the hospital board has made a very, very concerted effort to do something that I think is almost unheard of in today's era. In 2012, the Conley Memorial tax rate was 0.1448 per $100 evaluation, 14.48 cents per $100 evaluation. We received $3.3 million of tax funding during that year. Over the course of the next several years, we reduced it to 10.56 cents per $100 of valuation, and also simultaneously reduced our tax funding that we were receiving down to $3.128 million. So that is a key point that needs to be remembered by everyone in this room, is that your Conley Memorial Hospital Board is strongly committed to limiting its tax burden on Wilson County citizens, and has not only been making those statements verbally and in board meetings and in presentations for certainly the 3 years that I've been here, but has demonstrated it also with its actions in reducing the tax rate over the last number of years. So as we talk today about what has transpired and